We're now going to demonstrate to you adductor raises in side lying. The adductor muscles are the muscles on the inner part of your thigh. And the aim of this exercise is to improve the strength of these muscles and also improve your core stability strength. This can help with conditions such as groin strains, it can help with arthritis around the hip and knee, mechanical lower back pain and general soft tissue injuries of the lower limb. Now, weakness to this adductor muscle can increase the stresses and strains being placed on the pelvis, the hip and the knee, and this can ultimately lead to pain. You may find it difficult to perform simple activities such as bringing your leg in and out of a car, climbing stairs, standing from a seated position, and actually more active exercises such as sports, running, and actually horse riding if you take part in anything like that. It's really important that we strengthen this area because stronger adductors are more effective in protecting the joints and soft tissues around your pelvis and hip, and this can ultimately reduce your pain. But the key to this exercise is getting the technique correct, and that's what we're going to talk about now. So Pete, lying on a stable surface in side lying with your non-affected leg bent up to around 90 degrees of hip flexion and knee flexion. This is your affected leg, and what I want you to do with this, Pete, is gently raise this to its maximum point off the bed and hold that contraction and slowly lower that back down. Now you should feel this work in the inner thigh muscle and possibly around the groin. Good, it's normal to feel it working around this area, but one of the major faults with this exercise is when patients push too hard through their non-affected leg to try and lift this sore leg up in the air. Now, one way of counteracting this is to use a pillow. So we'll place this under Pete's leg, and what I'd like you to do, Pete, is to focus on this leg and not to push the leg down into the pillow. So you've got a little bit of feedback there. Can you repeat the exercise again? And you should feel that's concentrating the effort more on this affected leg. Good. Now, if you're unable to correct this technique using this tip, it's important that you consult your physiotherapist. Now, we recommend that you gradually build up to a maximum of 30 repetitions, holding for 5 seconds each time. Remember to take regular breaks when you feel you need to. Alternatively, listen to the instructions given to you by your physiotherapist. Now, Pete, it's normal to feel muscle ache in this area and some ache into the groin, but what we don't want to do is to reproduce your pain by greater than 2 out of 10, with 0 being no pain and 10 being the worst pain imaginable.